Hello everyone, Dr. Andrew, Dr. Sarah, my wife from Functional Wellness Center here in Scottsdale, Arizona. Today we want to talk about a traction in-home and in the office that we would do for somebody that needed correction in their low back. We specialize in a technique called Chiropractic BioPhysics, so we remold the curvature of the spine if need be, and one of the tools we use for that is the lumbar Dennerolls. These pieces of these equipment you see right here, they come in 3 different sizes, so it is very patient specific, depending how much curvature they need to be fixed. It depends on which size we would use. So they do come in 3 different sizes, and we're going to explain to you how we'd use that, and we're going to demonstrate it. So Dr. Sarah is going to set me up on that.
We have 3 different sizes here. The smallest size is for somebody like a smaller woman maybe, or maybe a child. That would need this. And then the other sizes are just dependent on how big, like if you got a bigger man and he needs more of a curvature in there, then we would use something like this. So let's show you how they're used. Now we can use this in office and they're used at home as well. And there could be multiple areas of the spine that need to be changed. So sometimes we're just using this Denneroll, and sometimes we're using multiple Dennerolls.
For different areas of the spine. So if you need the neck and the low back, we would combine those 2.
So we're always correcting the full spine when you come in, just depending on what you need. So I'm going to have you lay down there. And Dr. Andrew doesn't necessarily need this, but we're going to show you here. Now, if you need this point right here to be at the top of the lumbar spine, or kind of in the middle of the lumbar spine, you would place it like this, and then you would come down on it. And then you would have a block. Actually, let me grab that. Let me get you. Have a block about right there. And then his head would lay down there. And then that would help to reform the curve of the spine in the lower back. So if you lift up, now you can also reverse this if you needed more curvature down into the lower part of the lumbar spine and you needed that lumbar spine to come back over. You would place it like this, right up against the body, and then he would lay down. So another thing that we can do is we can do multiple areas at once. So say he needed some curve in his neck, then we can bring him down and we can put the cervical Denneroll there, and then we'd be hitting, all 2 or 3 areas at once. So it's really just dependent on what our patients need, and then we of course establish that through x-ray and analyzing the x-ray.
All right, well that's an example of how we would treat the low back, and if we had to incorporate the neck into that, we would also do that. So if you have any questions or like to have any comments or have any thing you need answered, go to our website, chiropractorscottsdale.com, and our email address is on there, or feel free to call us.
Thank you.